What's up, guys? This is Titan Lifestyle. That's right, it's Friday. I'm back once again. I do this every week at 2 p.m. Titan Lifestyle, I talk about therapy of the week. I talk about Titan events, question and answers, my favorite part of the show. And we're also getting into one of the topics that I picked out for today that has to do with blood pressure. So, anybody out there dealing with blood pressure issues or blood pressure readings, how to check it accurately, tune in. I'll get to that in a little bit. First, I want to give some shout outs. We got Curtis on here. We got Legend on here. We got Good Tampa Food. Good Tampa Food. Where is the Good Tampa Food? I see the handle. I could use some Good Tampa Food right now. So, what does that mean? Is that handle? Do you have food? Do you have a service, or what's up? Because I'm hungry. I like clean food, and I'm always ready to eat. So, anybody else that's on right now? Let me see who else is on. We got Oracle, Big Stapes. We got Tom Dollarhigh. He's always on here. See what we got on the Facebook and the TikTok as well. Also, you guys can check us out on Facebook, TikTok, and YouTube. You can hit the bell to be notified of videos just like this. And also, I have a podcast as well, so you can listen to all these episodes. I've done like 200 episodes, so you can always go back and listen to stuff if you missed it, or if you just want to listen to me again, or touch up on some Titan knowledge. It's always good too. But let's jump into the therapy of the week real quick. This week's therapy of the week is actually we actually have a Halloween special going on right now too. So full panel blood work for males and females. Normally our full panel for male is 200. With this discount, Halloween discount, it's only 130 for males, and again, that's a full panel. For females, normally it's 300, but with this Halloween special discount, it's going to be 200. So guys save $70, women save $100. And again, you could jump on this blood work special, pay for it now, and use it later too. So I know a lot of times people are like, do I need to do it right away? I mean, it's always good to know where your blood work, your levels are at all times. But if you want to pay for it now and use it later, or you could even use that as a gift card as well. We have Titan Medical gift cards here. So a lot of men, we're very bad with getting our blood work done. We're very bad with going to the doctor. We kind of tough it out. So ladies, if you have a husband out there that's been putting off getting his blood work done, this would be a great little gift. Give him a little gift card or a little gift or something like that, Halloween gift. Get him his blood work. Get him a gift card so that way he has to get it done. But again, 130 is the sale price for men. 200 is the sale price for women. And again, that sale ends soon, so you want to jump on that right now. Just call the office, 727-389-3220. Let them know you've heard about Drew mentioned the Halloween special, and that you want to be discounted on your blood work. You could also contact me as well, and I can hook you up with that same rate, or I can call the office and have them put it through at that same rate for you. So definitely want to jump on that. Blood work's very, very important. A lot of times people Google search what their symptoms are, or what they're experiencing to figure out what to troubleshoot. Or they'll ask their friend, hey, I had high blood pressure. It was my headaches that told me that. So now they think their headaches tell you that. So it's always good to actually get your blood work checked to figure out where you're at, rather than just, you don't want to misdiagnose. You don't want to misdiagnose yourself and say, it could be blood pressure, it could be hemoglobin, my estrogen might be high because I have this or that. So it's always good to get your blood test so you could actually know. And again, taking the worry out of it is also going to help with anxiety issues and stuff too. People can literally, their health can deteriorate from overstress. If you stress too much, your health can go downhill. So if you're stressing because you're not sure what's going on with your body, even more so, get your blood work done so now you can know exactly what's going on with your body, so you don't have to stress. You know how to troubleshoot it, so you know how to fix the problem, because it's all about being healthy. It's not just about looking good, making the mirror look good, and feeling good and all that. It's about being healthy within and living longer. That's what we do here at Titan Medical. We like to keep people healthy, not just keep people sick and keep giving them medicine like a lot of hospitals do. Here we like to actually fix the problem, diagnose the problem through the blood work or whatever, and then fix it for whatever therapies or treatments we give you. So it's not just about making you feel good, so actually fixing the problem. So if you have high estrogen and your blood work shows that, we're going to give you something to bring your estrogen down. If you have low testosterone and your blood work shows that, we're going to give you something to bring your testosterone up to optimal levels. Not Ronnie Coleman levels, just optimal levels. Again, if your blood pressure is high or your hemo's a little bit high, blood test is gonna determine that as well. So Very, very important. I say it all the time about blood work. It's very important. I never got it done. I used to just, back in the day, I used to just figure it out, Google search, and then just numb my symptoms rather than treating them so they don't come back again. Cloyd D111 says, how you feel about TRT replacement? TRT is testosterone replacement therapy. So if you guys hear TRT or if you hear HRT, that basically just means testosterone replacement therapy or hormone replacement therapy. Pretty much the same things. I feel great about it. Again, a lot of men, when they get older, women also too, your testosterone gets low. So you start having, you don't have the appetite, you don't have the sex drive, you don't have the energy to get out of bed. You don't have the recovery time if you like to work out that you do when you're younger. Usually it's the decline in testosterone what's causing that. So I feel very good about testosterone replacement therapy. If you get your blood work done, then you could get your feel great again. So in other words, if you're a guy that's 40, 50, you don't know why you're so tired all the time, you have no sex drive, you have no appetite, you can't get a pump in the gym, it's just off, and you want to get that feeling back, chances are you have low testosterone. And once we figure out where your testosterone levels need to be and get you to optimal level, now you're going to feel good, you're going to have that spark, you're going to have the energy, and also a general sense of well-being. When it comes to TRT or HRT, a lot of times people just talk about the benefits that it'll give you cosmetically or in terms of your health, in terms of longevity, recovery, libido, like I mentioned, but they don't really consider HRT as a mood enhancer. But if your testosterone is elevated, you're also going to have a general sense of well-being. So if you have low testosterone, you're going to be depressed, you're going to have anxiety, you're going to be very lethargic, it's going to be hard to move around, hard to get out of bed, hard to just get motivated. So when your testosterone goes up, now you have better energy, better appetite, better sex drive. And again, it's a mood enhancer, so you're going to have an overall sense of well-being. So you're going to be basically in a better mood throughout the day. And then again, that better mood could also be because you're healthy, you're treating everything the right way. So it goes hand in hand. A general sense of well-being. I don't see that listed as a lot of the benefits of TRT, but it definitely will give you a sense of well-being. Basically, just have yourself feeling like yourself again. Cloyd says, yeah, he's 44, low energy. Yeah, low energy is usually the first sign. Low energy, low sex drive, low appetite, usually the first things. Whether your testosterone starts going down. We have another person out here. He says 61 on TRT, blood work done everywhere, 8 weeks. Hemoglobin a little high. I donate every 8. Yeah, hemoglobin. He said his hemoglobin's a little bit high. He gets his blood work done. It says everywhere 8 weeks. I'm not sure what that means. If he gets it done every 8 weeks, which is 2 months. But he says his hemoglobin was high. Basically, that means his blood. Put it in the simpler terms, basically means his blood is thick. He's saying he donates blood. People call it a blood dump. If your hemoglobin gets high, a lot of times guys will go get a blood dump where they donate blood just to thin out their blood a little bit. That's good to do, but you don't want to do it too much because you want to actually fix the problem to figure out why your blood's getting so thick rather than just keep dumping it. But it's always good to do a blood dump once or twice a year. He still has his libido. That's good. Libido could be from the TRT as well. But yeah, I hear that a lot. People say, oh, my blood pressure is high, my hemoglobin high. Should I do a blood dump? Well, first of all, I'm not a doctor, so I'm not going to say whether you should do one or not. I've done blood dumps in the past, what basically means you just give blood because your hemoglobin, your blood's a little bit too thick. I've done it in the past, but I'd rather just stop whatever I'm doing to make the blood thick or start something to make it thinner. We have plenty of other therapies here that can have other benefits, not just in terms of muscle building and stuff like that too. So always want to make sure you fix the problem rather than numb it. And what I mean by that is I talk every week about if you have joint problems, don't just take Advil and take masking agents. Actually take something to fix the problem. So when people do a blood dump or they donate blood because their hemoglobin's too high, when they always do that, it'll temporarily thin it out or bring it down or up, but it's not fixing the problem. So you always want to make sure you're fixing the problem. That way you don't have to do blood dumps. You don't have to take masking agents. You could basically just be over and done with whatever issue you have. Any other questions? Let me see. Hydra Shock has not a question, it says a statement. It said the fact that these guys are prescribing AIs means they have no business advising anyone. Um, give people idea what he means by that. And again, it's good to have statements like this too, so I can correct them. It's not always good. I mean, you don't always have to agree with me, or you don't always have to ask me a question. If I say something that's wrong, correct me by any means. So I like having stuff on here too, just so I can address it. Um, he's basically saying that the fact that these guys are prescribing AI means they have no business advising anyone. Now, AI is an aromatase inhibitor, basically something that people use normally to bring your estrogen down if your estrogen's too high. Again, if you're taking testosterone, your estrogen is elevated, you may be prescribed anastrozole, otherwise known as Arimidex, or tamoxifen, otherwise known as Novadex, to bring your estrogen low. The fact that he said that the fact that they're prescribing AI means they have no business advising anyone. Now, if we get your blood work back and your estrogen is high, why would we not do something to control your estrogen? Like, why would we just allow your estrogen to be elevated so then you could have other side effects, whether it's gyno, whether it's development of male breast tissue, you could have oily skin, you could have water retention, you could have high body fat. There's a lot of other things, mood swings, hormonal stuff. There's a lot of other things that go with estrogen. So if your blood work says your estrogen is high or very high, that is the reason why medical providers, not just us, but other ones, would prescribe you a aromatase inhibitor to bring your estrogen down. So you don't have to worry about growing male breast tissue or have other issues. So that would be the reason. I see other places now, they say, it's not good to give an AI. We don't do that, but why? If your estrogen's high, why keep it high? I mean, now maybe other things, other reasons why certain places aren't prescribing AIs, but if your estrogen is high, why not fix that? That's like saying we do your blood pressure and your blood pressure is high, and we continue giving something that your blood pressure is high to make it high, but we don't do anything to control your blood pressure. So once again, we're trying to keep you optimal on all levels. So some people may not need an AI. Most people do. Again, everything goes off the blood work. So that would be the reason why they would advise to give you an AI with HRT. Some places now, they don't believe in it, or they just cancel it out. I'm not sure why. But again, if your estrogen high, hemoglobin high, blood pressure's high, you always want to make sure that you keep it in check, or take something to make sure it doesn't get out of check. Does creatine affect your liver enough where drinking on top of it will destroy it? I take creatine every day. I do it in between 10 and 20 grams, 10 and 15, 20 grams a day. I'm not a drinker, so that doesn't really apply to me. I mean, every once in a while I may have a shot, but I mean, that's just to be polite. I don't really drink. I just don't I don't see the purpose in it. I don't see the purpose in drinking to make myself feel sick, and now I can't work out or eat the next day. It just doesn't make sense to me, so. But in terms of taking creatine while you drink, obviously avoiding alcohol at all costs is better, or limit it as much as you can. I wouldn't combine them together. I've seen crazy people do that where they're like, yeah, I'm gonna take a shot of vodka with my creatine. I mean, I don't see the point in it. Some people say they take alcohol with creatine for a pump before the gym. Hercules Potion is injectable that we have here at Titan Medical Center that you could take before you train to give you a pump in the gym where you're not gonna have to wreck, your kidney and your liver from the alcohol. But again, I would say within reason, if you could avoid alcohol at all costs, better. What benefit is the alcohol doing for you that the creatine is doing? And what I mean by that is if you're going to put something in your body that's going to help you build muscle or recover faster, or whatever reasons you're taking the creatine, why put something else in your body along the same time period that's going to go the other avenue? It's kind of like taking a sleeping pill and a caffeine pill at the same time. You might as well just go with one or the other. So if you have to choose one or the other, obviously I go with the creatine. So alcohol destroys your body more than anything else that I've seen. I mean, other stuff, hardcore drugs and stuff too. But I mean, in terms of like whether it's marijuana, whether it's cigarettes, alcohol, anything like that, alcohol literally destroys your body more than anything else. It's hard to recover from. And one thing with alcohol, I'll say, is as soon as you put alcohol into your body, it makes it that much harder to burn fat and that much harder to build muscle. So I'd say avoid it at all costs, and I definitely don't have it within the same time period. If you do decide to have a glass of wine or a beer or a drink, which I wouldn't recommend, but if you do decide to do it, don't have it within an 8 to 10 hour period of your creatine, because you don't want that to be, you don't want it to be like a double whammy. But yeah. John Kerp said, "What about baking soda?" I'm not sure what you mean by baking soda. I'm not sure if he's talking about a pre-workout. We have other guys asking about pre-workout. I feel like the best pre-workout right now would be ECA. Titan Medical Center has ECA capsules. It's a capsule. It's ephedra, caffeine, aspirin, B12, and choline. You just take that before you work out. It's going to give you a good boost. And then combine that with some Hercules Potion. Hercules Potion is an amino injectable blend. So you would spot inject the muscle before you train. So if you train your biceps, you inject your bicep, take a ECA capsule, and that's pretty much all you need. Obviously, rest the night before and a little pre-workout meal. But ECAA and Hercules is pretty much all you need for a pre-workout. Now, if you guys are coffee or tea drinkers, if you drink coffee every day, like all the time, if your body's kind of used to it, you could do an ECA or with your coffee. I wouldn't drink 2 coffees or have 2 CA, but that's only if you're prone to, like if you're a coffee drinker, you know. Certain people, they just wake up in the morning, have a cup of coffee. They may be at work at their desk or whatever. They have a cup of coffee. If you could have coffee throughout the day, you're the type where you've been drinking coffee since you were a little kid or whatever. In other countries, they drink coffee when they're younger. You can get away with the ECA with the coffee. So green tea or coffee, ECA, and Hercules Potion is like the perfect pre-workout. Um, Yeah, as a pre-workout, baking soda actually works good as a pre-workout. But I used to take baking soda as a pre-workout because it helps with lactic acid. Like if I'm doing shoulder press real heavy, my shoulders just get so much. I don't even know what to do with them. I have to set them on top of something where the lactic acid is so intense. Baking soda helps with that, and that's what I used to use before I started taking Hercules Potion. Hercules Potion will actually help with lactic acid buildup too. Helps with pump, vascularity, stamina. So when you're going through a lot of sets, a lot of reps, normally when the lactic acid becomes too intense, the Hercules Potion will actually help with that. Baking soda works good for lactic acid to help with the reduction of lactic acid, but it doesn't necessarily give you that pump and vascularity that Hercules Potion will. So, but again, you could combine both if you really want to. But again, Hercules Potion will do the same thing. More effective, and again, you don't have to worry about going through your stomach. So if you have food, it's not going to slow the absorption down. Primal, primitive structure. Go to low T. Go to low T center. $68. Blow. I'm not sure what that means. Yeah. Yeah, it's probably not a full panel, and it's probably. I mean, I'm not sure what that is. Anytime something seems too low like that, it seems kind of suspect to me. Our blood work is a full panel. A lot of other places say that they do a full panel too, but I mean, I challenge it to ask them what is actually in their full panel. Well, they say, yeah, we test for everything. We test estrogen, testosterone, and hemoglobin, and they think that's everything. So, ask what your full panel blood work from wherever you're getting it from. Ask the list of what they test, and then we can give you our list. Our list is a legit full panel, and again, males 130 with the discount, and females 200 with the discount. I got my Hercules Potion yesterday. Gonna try it now. Perfect. Now you're gonna try it like right now? Well, like today or now? If you're gonna try it right now, let me just ask real quick, where are you gonna use it? What body part are you gonna use it on? Just so I can give you a little bit of maybe a little bit of advice, a little bit of opinion if it's your first time trying it. I'm not gonna walk you through on my live, but I'm just always interested to see why people get Hercules Potion and what they use it for. I have some people say I need to get my calves. Some people say my biceps. I know my boy John likes to do it in his chest before chest day. So, pecs. Gonna do some pecs. Yeah, pecs are very good. You want to do your upper pec. So if you're doing your pec, I have a guy on a live doing it right now. But if you're doing your pec, don't go near the nipple. You don't want to go lower. You want to go upper. So if you're doing chest, say my chest. Let me see if I could. My chest be up here. So you want to hit like in this region, upper. Up. I like to do upper and outer, so I'm like over here. So when I'm pushing in, I can feel it here. but I like to go upper outer. I know John does a little bit more in here, but most people have a lower chest already. The upper chest is what they need to hit. So a lot of guys, they'll do it in their upper chest, so that way when they're training, they get that shelf, they get them the cuts up top. But you definitely don't want to do it down here, down around here. I mean, I don't see the point in that. But yeah, let me know how you like it. Are you going to do 1 ml on each side? Are you going to do one side? Are you going to do half and half? I would recommend doing 1 on each side or half on each side. I never want to do, ever since I've done Hercules, I never just do one side. It would be weird for me to do like one arm, but I'm training both arms because I feel like one's more than the other. So I always have to go whatever's like left, right. So if I do left tricep, I do right tricep. If I do left shoulder, right shoulder. So yeah, half and half, good stuff. Also, I'm trying to get your name right. Is that FTE Jera? Sorry, FTE Jera _ ME. Yeah, I'm not sure. Jeremy. Oh, FTE _ Jeremy. Okay, I got you. Also, too, is that the only thing you have from Titan Medical is the Hercules Potion? Because if you guys have Titan Complete with Hercules Potion, you could actually put half an ml of Titan Complete in one syringe and then put the other half of Hercules in the same syringe. So that way you're getting a little bit more volume. So instead of doing half Hercules here and half here, you go half Hercules and then another half of Titan Complete. So it's the full on each side. That you could do too. I've done that before just to get a little bit more volume in there. Let me see. Mike Santiago started with a 500 testosterone cypionate, 400 primo a week for a beginner, 42 years old. That sounds too high for a beginner. Basically what you're doing is 2.5 times an HRT dosage, which is 500 milligrams of testosterone cypionate. Normally with testosterone cypionate, HRT, the high end will be 200 milligrams a week. So if you're a beginner, I wouldn't start that high. I would go through a medical provider like Titan and do it the right way. So that way you're only doing like maybe 200 milligrams a week. Because if it's your first time starting it, why go right to 500? I mean, you might do 200 and feel great. And with the Primo too, you might not even need that Primo. First of all, Primo is not something that we can prescribe here at Titan, so I wouldn't recommend taking it. And second of all, if you're going from nothing to 500 test and Primo, you don't know how much you're really going to need to get a benefit from it. So I would recommend, getting your blood work, going through a medical provider, doing maybe 100, 200 milligrams a week, HRT dose, see how you feel, and then make adjustments from there. But it makes no sense. That'd be like someone who's never taken Advil before, all of a sudden taking 5 Advil at once. See, I mean, you really, when you're starting out something new, you want to make sure you know what's working. And you want to take too much. So again, I would just recommend going through a medical provider, do HRT dose, come to Titan if you need to, and then see where you're at. And then you could slowly, make adjustments to see where you're at. Going from 0 to 100, I'm not sure what's going to happen. Where you can get Hercules Potion. We have Hercules Potion here at Titan Medical. It's one of our special blends. It's a custom blend that we have here at Titan. It's aminos. So it's basically a concoction of a bunch of aminos, and it's going to give you a pump. So if you call 727-389-3220 and just let the girls know on the phone, I spoke to Drew, or I heard Drew on the live. He told me about Hercules Potion. They can get it out to you. Hercules Potion does not require blood work also. All you have to do is fill out the new patient paperwork. So if you need that link, you can check on the IGs, check on Titan's IG, hit the link, fill out the new patient paperwork. We have a male and female one. Then once you call the office, 727-389-3220, just let them know I filled out my paperwork and I need to get Hercules Potion. They'll pull you up and basically you can order from there. Hercules Potion, you could also let them know Big Drew said a discount. They'll give you a little bit of a discount. But again, yeah, Hercules, you're going to love Hercules. You're going to love Hercules. A lot of other places they try to do what we're doing and they have these amino blends and this and that, but it's not the same. And again, those places, if you can go online and just order it from a research peptides place, and you got to be careful with that stuff. So our stuff is legit. It's going to be doctor prescribed. It's going to be coming from a U.S. pharmacy in your name, in a prescription bottle specific to you, so you know what you're getting. It's going to have batch numbers, lot numbers, so you can look it up. You know it's legit. You know it is what it says it is. And again, takes the worry out of, not knowing what you're taking is real or not, too. I'm going to jump into one of these topics. I talked about blood pressure a little bit earlier. I know people were talking about hemoglobin. That kind of goes a little bit with blood pressure. But certain arm positions during blood pressure checks may lead to inaccurate results. Now, this is very, very, very important because I've been in this situation the past 3 times that I've gotten my blood pressure taken. When I've gotten my blood pressure taken, the first time I had coffee that morning and I shouldn't have, so it was too high. So it said I was way too high. Hypertension, all that. I was like paranoid. Wait a minute. I remembered I drank the coffee. Second time, if your arm is hanging, if it's hanging, it might read differently than if it's resting on a table. So when the arm is resting on a hard surface, such as a desk, or slightly lower when the arm is resting on a person's lap or hanging by their side. So in other words, it's going to make a difference whether the arm is hanging or resting. Now, if you go drink a cup of coffee and your arm is hanging on the side and you just had a big meal and all that, your blood pressure is probably going to be all out of whack, which mine was 3 times. When I came back the third time, make sure I had no stimulants in my system, rested my arm on the table, everything was fine. Now I'm good. So a lot of times people have been getting their blood pressure checked the same way for many years, and they think, oh, I may have high blood pressure, hypertension, because every time they go in, whoever's checking their blood, whoever's doing their blood pressure has them hang their arm, and they go through the same procedure that they've always done. Now, I challenge people, if you're getting your blood pressure done a certain way, go in now and now rest your arm on the table, or not talk when you get it done, or not have any stimulants for 48 hours before you go in. Because what happens is if you get your blood pressure done, it comes back as being too high. Now you might be misdiagnosed. Now you might be on blood pressure medication for hypertension. You might be borderline diabetes, all this stuff just because it was an inaccurate reading. So very, very important. I know this happened to me. I was kind of freaked out when I got my blood pressure. It was very high. And then I went back again. It was very high again. I was freaked out. But once I went back and did everything the right way, it was fine. Then I got it checked again just to make sure, and it was fine now. But very important. A lot of times people automatically think, oh, I can't have coffee or pre-workout, or I have to be fasted, or I have to be this. Arm position is everything. I mean, even if your clothing is too tight, if your clothing is very, very tight, if you have like some type of cuff or some type of tightness on your arm or whatever, you want to have loose clothing, you want to have your arm rested on something, you want to have no stimulants in your system, and you want to be relaxed. You want to be talking and being all amped up, having a conversation. You want to keep your mind, because everything is going to, like, literally, as soon as your heart starts beating faster, it's going to have that reading as, oh, it's too much. It's high blood pressure. So very important. Keep your arms in the right position and a lot. It says 53% of participants were female, 77% were black, and 41% had their body mass BMI higher, which classifies them as being obese. So just because of their ethnicity, because also too, black people will have a different blood pressure reading than white. So when I get my blood pressure taken, I have to ask the people, okay, well, black people have different, and even on the blood work from someone who's African American will show different things than someone who's white. It's just how it is. So all this stuff makes a big deal. So if you get your blood pressure done and, the doctor isn't aware of that, or the medical provider isn't aware of that, bring it to their attention. Be like, oh, well, I heard that, African Americans have this, or women have this, or arm position. Let them know that, because you might be helping them out too. So, but yeah, resting on their lap, lying on a hard surface, or hanging along the side of their body are the 3 different positions. So again, and also too, if you get your blood pressure taken and it seems high, right then and there say, wait, it seems high. Can we try it again? Then lay your arm down and then do something different, because it might change that quick. So very, very important. You never want to misdiagnose stuff. You never want to be taking blood pressure medication if you don't need it. You don't want to be walking around paranoid thinking you're going to have a stroke or a heart attack because your blood pressure was through the roof because you didn't do it the right way. So I thought this is a good point for me to bring up, because I had this issue about a month ago when I got my blood pressure taken. I was kind of freaked out, and I was like, wait a minute. So I started doing all this research about blood pressure and reading it correctly, this and that, and I came up with some some good topics about it and good ways to make sure you get an accurate reading. So also too, when you get your blood work or fever and all that stuff too, that's a whole nother show. But when you get your blood pressure taken and we get your temperature taken, those are two things that if they're not done correctly, it can very misdiagnose you and have you on some meds or some things that you don't want to be in. So make sure you do everything the right way, make sure stuff's accurately so that way you can be healthy and not have to worry. Someone else is asking about Hercules Potion. Yep, we have Hercules Potion here at Titan, 727-389-3220. And we service nationwide. So whatever state you're in, we'll get it out to you. Idaho, we have problems shipping to Idaho, but if you're in a neighboring state and you have someone there, we can ship it to them, and then they can ship it back to you too. All right. That's pretty much it for right now. I know we have just had two events. We just had the Olympia a few weeks back, and then last weekend was the Hurricane Pro. Great shows. Next thing up is Cars and Couture. That's going to be November 16th. Cars and Couture, it's a car show. It's going to be a crazy car show. Bugattis, McLarens, Ferraris, Lamborghinis, all kinds of stuff going on there. So it's going to be a great car show. And again, I believe it's November 16th.
Nah, they pushed it back.
Oh, they pushed it back. Hold on, they pushed it back.
Yeah.
I'm going to get a correct date for that on you. But yeah, Cars and Couture is great because you can it's kind of like a big car expo. It's going to be February 8th. Whoa, they pushed it back. Okay, so it's pushed back. It was originally November, so now it's going to be pushed back a couple more months. It's going to be Saturday, September 8th from 6 p.m. to 10 p.m. And again, it's the 14th Annual Gala Collector. You're going to have a whole bunch of luxury car shows, fashion shows, live band performances. Yeah, it's going to be a great time. It's also benefiting, let me see what's benefiting. I need to see, benefiting Jacob's Touch Foundation. Jacob's Touch Foundation is a nonprofit 501 community-based organization in Tampa Bay area dedicated to providing financial care and assistance to families and organizations supporting children with autism on the autism spectrum. So yeah, shout out to them for doing that. Big shout out to them. They always hook it up. They always do the autism benefits and stuff like that. So it's awesome. It's going to be a great show. I love these shows because it's like basically like what I was saying before. It's like a big car expo. You'll see hundreds of tables and hundreds of nice, maybe thousands of nice cars, and you'll see like a booth, and you'll see like a guy will have his car out there. It'll be roped off. He'll start it up for you. He'll tell you the year, make, and all that. You can take pictures with the car. You can ask about the car. It's like a whole bunch of car enthusiasts, whole bunch of models, like a fashion show, car show, live music. Yeah, it's going to be a good time. There's always got some good food over there, too. So, yeah, push back from November 16th. The new date is February 8th, and that's from 6 to 10 p.m. You can get tickets online. Check out TitanMedicalCenter.com. You could always call the office and ask them how you can get tickets as well. I'll be back next week. Shout out to Rocker Stylist on here. I see my boy on here, Rocker Stylist. Hulk Squad. I haven't seen Hulk Squad. Let me get some shout outs real quick. Hulk Squad. We got Brian. We got Fit Jeremy. We got the Irish Bulldog. We got Embry just joined on here too. So yeah, always good you guys tuning in. This is Titan Lifestyle. I do this every week. Hit the bell on our YouTube channel so you're notified of videos like this. You could also check me out on my podcast. I've done over 200 shows. So you got plenty of options, plenty of ways you can listen to me. You could also check us out on Facebook and Instagram as well. For Titan Medical Center, I'm Big Drew. This is Titan Lifestyle. I will see you next week. Have a great week.